Okay, so good morning, all of you. I hope I'm audible. Just let me check over here also. Yeah, it's okay. Good. So let's start the session. So this is a IMAGETHON session. Images on anatomy, IBQs, image-based questions on anatomy for our upcoming NEET PG 2023 questions paper, right? And I'm Dr. Ankit, anatomy educator. And let's start the session. Few updates before we go ahead. Why Unacademy? These are all the features of Unacademy. I hope you all are aware, but still you can have a look at it. Medical educators, top medical educators, recorded classes, plus live, plus recorded, dedicated doubt solving, and all the features over here. Lot of stories also. NEET PG FMGE preparation, these are the plus batches, iconic batches, and I can also say up to these percentage. These are all the top educators in an academic platform. FMG also, crack FMG with FMG mastery, ultimate concise batches coming up, so you can have a look at this as well. FMG success stories, there are a lot more, right? So apart from these stories, there are a lot more. So yes, you can be inspired by this. And there is a final booster batch for 1 month, started already on February 1. If you want to join it, please do come and join it. Right? You can use the code always. The code remains Dr. Ankit 10. The code remains Dr. Ankit, ANKIT10, Dr. Ankit 10, right? Let's come to our IMAGETHON anatomy, image-based questions on anatomy. Let's start the first one. 54-year-old lady comes to the physician because of a one-day history of fever, chills, and double vision. She also has a 2-week history of headache and foul-smelling nasal discharge. Corneal reflex is absent. Absence of corneal reflex is most likely caused by compression of which of the following labeled structures, right? So here you are seeing a section, and these are labeled structures A, B, C, D, E are labeled. The question is that absence of corneal reflex is due to compression caused by which of the following labeled structures? That's our question. What do you think? What the answer? A, B, C, D. You can give the answers over here in the comment box. I'll be watching your answers, guys. I'm waiting for your answers. Right. Anyone? So corneal reflex, this is a section over here. It's a corneal section of the cavernous sinus. As you can see, the pituitary gland over here. This is sphenoid layer sinuses. These are two cavernous sinuses, cavernous sinus. And you can see the labelings are onto the lateral wall of cavernous sinus, and we all must be knowing that the lateral wall of cavernous sinus has a lot of what we say as the cranial nerves. So B over here is the third cranial nerve, C is the fourth, D is the V1 ophthalmic, E is the V2 maxillary, and this is the internal carotid artery, and along with it, the nerve over here is the abducens nerve. Now they're asking of the corneal reflex. Corneal reflex, when you touch the cornea conjunctiva, you suddenly close your eyelids tightly, right? So the afferent limb of the corneal reflex, the afferent limb of corneal reflex is the sensing nerve supply, that is the ophthalmic division, and the efferent limb, which will contract the orbicularis oculi muscle, is the facial nerve, the seventh nerve, right? So if you look at this image, you have to see at one of these two. So you don't have any seventh facial nerve over here, but you still have the V1, that is our option number D. So answer would be over here, the option number D. I hope it is clear. The answer will be over here, option number D, that it is due to the D is our V1, the ophthalmic division. So when this is injured, then there will be absence of corneal reflex. Clear? Let's see the second question. A patient who has undergone a radical mastectomy with extensive axillary dissection exhibits winging of the scapula when she pushes against resistance on an immovable object such as a wall. So history of mastectomy and axillary dissection, winging of the scapula. Injury of which of the following nerves would cause this particular problem of winging of scapula? So basically you have to figure out winging of scapula is due to lesion of which nerve, and then we have to identify that nerve in this diagram of the brachial plexus. That's the question. Anyone in the comment box want to give the answer? Winging of scapula, what's the nerve? The muscle is serratus anterior, so we know there is paralysis of the serratus anterior. So obviously the nerve is the nerve to serratus anterior, also known as the long thoracic nerve, the medial winging of scapula. So in this brachial plexus, we should know that you can see the vertebrae over here. So this must be the area for the roots. Then there are the three trunks. Then there are the divisions over here. Then there are the cords, and then there are the branches. We all should know the long thoracic nerve is coming from which part of brachial plexus? Yes, it is long thoracic comes from which part of brachial plexus? comes from the root of brachial plexus. So root is this area, the proximal area. And the root value of the long thoracic nerve is C5, C6, C7. So it's a long nerve. So if this particularly, this is the root area. So the only labeled structure is C. C should be the answer and C is the answer. C is the answer over here. These are the three trunks, the upper trunk, the middle and the lower trunk. Have a look at it. Then there are various divisions. Each trunk will give two divisions, ventral and dorsal. Finally, we have three cords. Remember, this is the posterior cord over here. This lies behind the axillary artery. That has to be the lateral cord and this has to be the medial cord. And these are the three divisions, right? If you look at other labelings, for example, label number A, this is a branch coming from the lateral cord, right? This is a branch coming from the lateral cord. Lateral cord has three branches. LML is a mnemonic, lateral pectoral, musculocutaneous, and the lateral root of median. This appears to be the lateral root of median. This appears to be the musculocutaneous. So this is the lateral pectoral nerve, option number A. If you look at other options like option number B, it is a branch coming from the upper trunk. These are the three trunks, upper trunk. Upper trunk gives off mainly two branches, the suprascapular nerve and the nerve 2 subclavius. This appears to be the suprascapular nerve, option number B. Supply supra and infraspinatus. Let us see other labelings, D and E. Now this, as told you, is the posterior cord. And posterior cord will continue as a radial nerve, and it is one more important branch is the axillary nerve. These are the initial three branches of posterior cord. And these are particularly the upper and lower subscapular nerves plus the nerve 2, the latissimus dorsi or the thoracodorsal nerve. So this D and E, particularly E would be the lower subscapular nerve and D would be the nerve 2, the latissimus dorsi or the thoracodorsal nerve. I hope this basic revision of the brachial plexus is clear. Come back to the question, the answer is our option number C, beginning of scapula. So have a look at the diagrams as well. Brachial plexus, very important topic. Let's move to the third question. Here is the third question. Having fallen while jogging, a 62-year-old male is admitted to the emergency department with a severe chest pain. Physical examination reveals acute MI, myocardial infarction. After the patient is stabilized, angiography is performed and one of the major coronary arteries is observed to be occluded. Which of the following arteries is most obviously occluded or blocked by the atherosclerotic plaque or the clot? Here is the angiographic image and here are the options. They are saying it is a case of acute MI, fine. What is this labeled arrowed artery? Which artery is this? Right coronary, left anterior interventricular, diagonal or the circumflex? Waiting for your answers over here. You are going with option number B. Are you going with this question only or the previous one? Come on guys, give your answer, Which do you think is the labeled artery over here, the arrowed artery? Which one? It is a case of acute MI. No other ECG findings are given, nothing is given. Just they ask you which artery is this. Pure anatomy plus radiography question. So, first of all, this is a which artery? Are we looking at a right coronary or the left coronary artery? So the basic idea is, if you look at an artery which suddenly bifurcates into two arteries, it is probably the left coronary artery. The left coronary angiogram is what you are looking at. First point is this. Because LCA suddenly bifurcates into two. The original LCA is hardly 1 to 2 centimeter long. It then bifurcates into LAD and the left circumflex arteries, right? So it is a left. So we can remove the options like right coronary. Then we have options like left anterior. So there are two bifurcations. One bifurcation is going in this direction, one is this. So this is probably the LC over here, the left anterior descending LAD, not LC but LAD artery. And this is the LCX, the left circumflex. So this is probably the LCX, this is the LAD, left anterior descending. Now you can see this arrow, this artery is, anyone with the answer? B's and D's. Acha, B. But this is the LAD. Now this is a branch coming from LAD, not the LAD particular. Now please do remember one basic idea. First, let us strengthen the theory. As I told you that LCA will rapidly bifurcate into two arteries, the LAD and the LCX. Clear? Now the LAD is running in the anterior interventricular groove. Clear? Now the major branches of the LAD, what does it supply? It supplies mainly the septal branches. This is how we recognize the LAD. LAD, you have perpendicular septal and those septal branches are quite long. They are even 7 to 8 centimeter long. So it has perpendicular septal branches, very important branches. They supply the septum. Then it has another branches which are known as the diagonal branches. These are the diagonal branches. And these diagonal branches, they supply the anterior surface of the left ventricle. Now comes to the LCX. LCX is actually circumflexing around. So basically it supplies basically the left atria, left atrial branches, and apart from it, it will give the obtuse branches, it will give the marginal branches, the left marginal branches, like these branches. Now if you come back to the image over here, what we see is that this is the LCX artery, this is the LAD. This branch is coming from LAD. So it is probably going to the anterior wall of the LV. It is probably the diagonal branch. It is a diagonal branch of the LAD. It is a diagonal branch. Answer is option number C. Are you able to clear somewhat? This artery over here, this is the diagonal artery, the diagonal branch of the LAD, which is supplying the anterior wall of the LV, left ventricle, right? This is the LAD, this is the LCX. Somewhat clear? Let's move to the fourth question now. Here is the fourth question. 49-year-old comes to the OPD with complaints of bloating, gas, and a sense of fullness for the preceding 2 years. Which of the following structure is affected? Now, we are also showing the structure plus the symptoms of the patient, just to identify what is this arrowed structure. Is it a spleen? Is it a stomach, duodenum, or the descending colon? What do you think is this? Look at the other structures, look at the other structures which you can identify, and look at this luminal structure. Try to give the answer. What do you think is the structure with the symptoms of bloating, gas, and a sense of fullness? These descending colon, okay. Okay, descending colon, okay, fine. Complaint of bloating and a sense of fullness. Complaint of bloating, a bloating sensation is probably from the more proximal part of the gut. That is the sensation of bloating comes from more of the proximal part of the gut. Second thing, if you look at this image, there is a CT scan. This is an axial CT scan. This is the vertebrae, so there is a posterior aspect, that is the anterior aspect. Right? CT being, so this would be the right side, this would be the left side. This is probably a part of the liver that we are seeing, not a whole complete, but liver at a particular section. Bloating, spleen. Spleen lies where? Posteriorly and to the left side posterior. Somewhere over here should be the location of spleen, depending on where the section has been taken. Stomach is intraperitoneal and to the left side. This could be a stomach. Let's see other options. And also it's part of proximal gut. Duodenum, is it intra or retro? It is behind the stomach. It is quite a retroperitoneal. It is just in front of the kidneys. So these are the two kidneys. This would be the position of somewhat of the duodenum. It is crossing from right to left. And finally, descending colon is again a retroperitoneal structure. Descending colon is again, and where is descending colon? Onto the left side. So this would be the area for descending colon. Now back to this is probably the stomach over here being shown to you. Answer is option number B, that is the stomach. Right? So look at the structures, anatomy, correlate anatomy and radio, very, very important. Intraperitoneal are more anteriorly, the retro are more posteriorly. And you can see the symptoms and then take your own judgment. This is probably the upper part of the liver. So the whole liver, actually the liver is overlapping the stomach, but at level when you take that section, right? It's not always. Let's move to the fifth one. Here's the fifth question. Good. Popliteal arterial aneurysm can be very fragile, bursting with great loss of blood and the potential loss of the leg if it is not dealt with safely and effectively. That is a warning sign. In the previous century, Dr. John Hunter discovered that as the primary artery of the thigh is temporarily compressed, blood flow into the popliteal artery can be reduced long enough to treat the aneurysm in the popliteal fossa surgically with safety. This is the reason why we call it as a Hunterian canal or the subsartorial canal or the adductor canal. Also, Dr. John Hunter over here. Now, the question comes, what structure is indicated in the figure that is related to the surgical procedure? I told you half of the answer. Now, they are showing you something over here, probably a CT scan, axial or transverse CT, and an arrow is being located. The arrow is pointing towards the sartorius, femoral vein, femoral artery, or the adductor longus. This is what you have to judge. Looking at the image, what do you think? There are how many compartments of thigh? There are 3 compartments of thigh. The anterior, there is an anterior compartment, a medial, and a posterior compartment. Right? The 3 compartments of thigh. Looking at the image over here, the bulkier one is the anterior compartment. This must be the anterior compartment. This is probably the posterior compartment having the semitendinosus, the hamstrings. Anterior over here. So this is basically the medial compartment. This whole story is pointing out towards the Hunterian or the subsartorial canal. So this small hole over here, if you see, there's an area for subsartorial canal or the Hunterian canal being overlapped by a muscle, which muscle? Sartorius. And this is therefore this muscle over here or the muscle over here, this is referring to the muscle sartorius, right? Looking at other options, femoral vessels are the contents of sartorial canal. And if you do angiography, only then, or vasculography, only then will you see the vessels. Coming to the adductor longus over here. Adductor longus is forming a boundary. Which boundary? Here you have this area, this will be the location of adductor longus over here and over here. This would be the adductor longus. Right? So you have the vastus medialis, you have the sartorius, you have the adductor longus and the magnus from the boundaries of the sartorial canal. So probably this arrow is pointing towards the muscle that is the sartorius. This is the sartorius muscle over here. Right? Very good, Akshita. As you enter the option number 8, good. That is sartorius. Clear? So just idea of the subsartorial canal. Let us see the next one over here. Come again to the low limb. 63-year-old lady visits the OPD or the ortho OPD with the complaint of pain in her foot for more than a year. Radio and physical examinations give evidence of a constant extension. Look at it. Constant extension at the MTP joint. MTP joint is this metatarsalophalangeal. This is the MTP joint. Hyperflexion at the PIP and extension at DIP. So this is the PIP and this is the PIP, and we can say this flexion and this is the DIP, again extension. So DIP and MTP are having extensions. DIP and MTP are having extensions. PIP is having flexion, F for flexion. Which of the following terms is most accurate to describe the signs? You have to just say what is this known as. Flexion at PIP, extension at MTP and DIP. हाँ जी. A's and D's. A क्या है? Pes planus, D is clotos. Okay. Anyone else with the answer? सोचो. Flexion at PIP and extension at both DIP. What is claw? Remember claw hand से याद रखो. What was claw hand? Claw hand was extension at MCP or cloto में extension at MTP. But then in claw both the IPs, मतलब DIP and PIP, both these IPs they are flexed. Here the DIP is extended. ये extension में जा रहा है. Can it be clotos? ना लगता तो नहीं. Pes planus, pes cavus. This is all the medial arch of the foot or the arches of foot. Here are they showing any arches? No. बचा क्या? What is left is the hammer toes. This is a typical case of hammer toes. Remember hammer toes में you have the flexion of PIP but extension of both the MTP and the DIP. Hammer toe deformity is most commonly seen in this lesser toe, the fifth toe, most commonly seen over here due to the ill-fitting shoes. Any problem in the metatarsals or joint problem, could be any problem. But hammer toe is most commonly seen, but it can be seen in all other digits as all other toes as well. Right? So answer over here is yes. Very good. Guys, going with C option. Good job, Sarika and Akshita. Chalo, good. So yes, it is a hammer toes. Remember, hammer toe deformity. Okay. Chaliye, let us see this next one. Bataiye. Again, the low limb 34-year-old visits OPD for annual checkup. A radio of his knees is shown. Physical examination reveals no pathology or pain to his knees. There is no problem, just an annual checkup. The patient has no past history of any knee problems. What is the most likely diagnosis? Look at the arrow. I hope you can see somewhat the clarity of this image. What is being shown over here? Is it an enlarged prepatellar bursa, Osgood-Schlatter's disease, novel intercondylar eminence, or is it a bipartite patella? What is this shown in this particular image? Take your time. Do give the answer. There is no symptoms, no signs. कुछ नहीं है. Or sign you can say in this X-ray, something not normal is being shown over here. Think and give the answer. Look at the leg. This is the tibia, that is fibula. So this is the medial, that is lateral. Okay? This is lateral, that is medial. Fine. You're seeing some part of the patella being separated on the superolateral aspect. And it is seen in 1 to 2% population, bipartite patella. It is a common anatomical variation. It's common anatomical variation, bipartite patella. Most commonly there is a superolateral on the side. It appears to look like a fractured patella, but that is a normal variation. We can't do anything about it. Even if you study any of your anatomy books, in the applied column it is written over there, the bipartite, some tripartite as well. Bipartite, the most common location is superolateral, and there is no symptom signs, typical bipartite patella. Yes, option number D. Okay? So let's see the 8th question. Again an X-ray. 23-year-old male basketball player is admitted to the hospital after injuring his shoulder during a game. Physical and radio examination reveals total separation of shoulder. Total separation of shoulder. Which structure has most likely been torn? Look at this image. Look at all the bones, look at the humerus, the scapula, the ribs, the clavicle, whatever you can see. They are saying this, he had an injury, there was total separation of the shoulder. Identify which structure has been torn. Is it a glenohumeral ligament, coracoacromial, tendon of long head of biceps, or acromioclavicular ligament? बताइए. Going with the D's and B's. So, take few more seconds. Try to answer. There is a separation of the shoulder. There is separation of shoulder. Image is shown in front of you. आपको ligament ढूंढना है. Let us see the bones over here. What you can see. This is the shaft, the head of humerus. Clear? This is a part of the scapula being shown over here. यहाँ पे acromion, the coracoid in front over here. Coracoid acromion. This is a clavicle. Can you see some problem over here? Obviously, you can see. The clavicle and the acromion, they are joined by a joint. What is this joint? Acromioclavicular joint, AC joint. When we say separation of shoulder, it is basically AC joint subluxation or AC joint separation. That is separation of shoulder. Separation of shoulder is different from shoulder dislocation. When we say shoulder dislocation, it is this glenohumeral joint. It's between scapula and the humerus. When we say shoulder separation, it is separation of clavicle from the scapula. Right? That is the shoulder separation. So obviously you can rule out glenohumeral ligament. It looks okay. Coracoacromial ligament is between coracoid and acromion. Do they look separated? They are part of one bone. Coracoid is not getting away anywhere. We are not seeing a tendon over here. Obviously the answer left is acromioclavicular ligament. So the structure that is damaged is this acromioclavicular ligament. This is our best possible answer in this particular question. Am I clear? Look at this. This is the AC joint being dislocated totally. The coracoclavicular ligaments also will be distorted over here. Remember the few signs, if I remember, the piano key sign, you can actually tap the clavicle, the lateral end of clavicle, and it will go down and it will again come up. Right? Piano key sign. Chali, let's see the 9th question. Look at this question. 80-year-old male is admitted to the hospital with a drooping right eyelid. You can see the right eyelid over here, the drooping right eyelid, slight drooping. Which additional signs on the right side would confirm the diagnosis? बताइए. Constricted pupil, dry eye, exophthalmos, pale blanched face. I hope you can see some features over there. Chalo. There is a drooping right eyelid. The only feature that is showing drooping. So you should know that this muscle over here is LPS, and that is supplied by which nerve? Third nerve, but also it has a component of sympathetic with it. Right? So if you are seeing a drooping eyelid, if you can suspect any of these two things, either third nerve or the sympathetic are gone, then you can reach out the answer. Let me see if you have reached out some answers over here. Okay, A, very good. So if you're looking for the third nerve, then obviously third nerve, the eyeball will be located down and out. That is the problem, third nerve. But if there is sympathetic loss, there is obviously what we're dealing with the Horner syndrome. In Horner syndrome, there's meiosis. Why? Because the sympathetics are basically dilating the pupil. So when the sympathetics are not working, the pupil is constricted. So there will be meiosis or constricted pupil over here. There's an additional feature which you will see, and if you look closely by zooming it later on, you will see that the pupil over here is smaller in size than the pupil on the left eye. Right? And dry exophthalmos pale blanche don't go. So feature of Horner syndrome, and have a look at it. Chali, let's see the next one. Which of the following is a branch of the structure at the pointer? There is this image, pointer, this yellow pointer going towards some structure. They are asking you, which is a branch of this structure. They are not asking you this structure, इसकी branch कौन सी है? बताइए, right into thoracic artery, so it looks like some artery. पहली बात तो. Identify the artery and name the answer. Give the answer. All the best. देखो आराम से देखो, take your time, take few more seconds. Identify what is this organ over here. कौन सी artery हो सकती है? And then it will give up which branch. So, looking at the organs now, this is probably the heart over there, and the pericardium is covered by fat. Right? This is the heart over here. This is the pulmonary trunk coming out, and that is the aorta coming out. These are the lungs over here. Clear? Any answers by now? D. Someone saying D. Right subclavian artery. Acha ji. डी डी बी भी आ रहा है, बी क्या है, लेफ्ट कॉमन कैरोटिड आर्टरी से देखते हैं, लेट्स सी. So now I hope you have reached the answers. This is the heart, the two major vessels. Now what is this structure? Overlapping the aortic structure, but substance superficial there are veins. But this probably is going to the right side, could be the SVC over here, this could be the brachiocephalic veins, but that is not as asked. What do they cover is, you can see the aorta ascending and the arch of aorta. One of the initial branches of the arch of aorta which goes to the right side is the brachiocephalic trunk. This is probably the brachiocephalic trunk, and we all know that it gives off two branches, the right common carotid and the right subclavian. बस देख लो आंसर कोई है इनमें से. Answer is option number D, fourth option. This is the answer over here. ठीक है, the right subclavian artery, because the aortic structure was the brachiocephalic trunk. ठीक है, this you can see, this is a trachea over here. On the other side there will be left common carotid and other structures. This vessel is basically the left brachiocephalic vein. This is the right brachiocephalic. This is the SVC going to the right atrium. You can see the right auricle as well as over here. Clear? So let's see the 11th question. On the given radiograph, a fractured tarsal bone is identified by the black arrow with accompanying impaction of the tarsometatarsal joint. What bone? इस bone को पहचाना है. Which is this bone? It is a tarsal bone. Is it navicular, cuboid, talus or lateral cuneiform? बताइए. Which one is this? You can see this is the metatarsal with the tuberosity over here. This is probably the fifth metatarsal. That is fourth, third, second and first. अब बताइए कौन सी bone है ये? Which bone is this? Navicular A's and D's. A क्या भाई navicular है और D क्या lateral cuneiform है. अच्छा. It is neither navicular nor is it lateral cuneiform. This is the calcaneum. ध्यान समझो. Over it lies the talus. The talus forms a joint with the navicular. This is the navicular. The navicular, on the other hand, in front of navicular are the cuneiforms. This is the medial cuneiform, the intermediate and the lateral cuneiform. बचा क्या? This one calcaneum makes a joint. This is a joint known as calcaneocuboid joint. This bone over here is a, मिल गया आंसर, is a cuboid bone. The calcaneum cuboid lies laterally towards the fifth metatarsal and the talonavicular lies medially towards the first metatarsal. ध्यान से समझो बात को, ठीक है. आंसर इज ऑप्शन नंबर बी. वेरी गुड भवनेश एंड अदर्स. पार्थ, वेरी गुड. ठीक है. सो समझिए बात को कि आइडेंटिफाइंग टार्सल्स, आइडेंटिफाइंग कार्पल एंड टार्सल बोथ आर इंपॉर्टेंट. कोई भी आ जाएगा एग्जाम में, ठीक है. सो कार्पल्स यू ऑल नो, शी लुक्स टू प्रिटी, ट्राई टू कैच हर. वो can easily identify, but tarsals may also start identifying. Remember the cuboid and the cuneiforms, they form joints with metatarsal. So cues होते हैं ना, cues से cuboid और cuneiform, they are forming joint with metatarsals. Cuboid forms joint with the fifth metatarsal and fourth also. Fourth और fifth दोनों आते हैं with cuboid. 1, 2, 3 with medial, intermediate and lateral cuneiform. Fourth and fifth metatarsal with the cuboid bone. Let's see 12th one. बताइए. 29-year-old female elite athlete was lifting heavy weights during intense training. The athlete felt severe pain radiating suddenly to the posterior aspect of her right thigh and leg. Patient was taken to the hospital where an MRI was performed. Which nerve was most probably affected? Now look at the MRI. This is sagittal MRI being shown to you. यहाँ पर एक arrow आ रहा है showing some prolapsed intervertebral disc. To identify a vertebrae, कौन सी between which vertebrae and which nerve could be affected? बताइए. L3, L4, L5 as on there. Asking you which nerve was most probably affected. Nerve बतानी है. And other things are over here. Okay. Elsa going with C. Rudrakshi going with B. चलो, which vertebrae is this? This is the sacrum, this is the L5, that is L4. The prolapse is between the L4 and L5 vertebrae. Prolapse is between the L4 and L5 vertebrae. The nerve that comes out from here is L4. The answer L4 होना चाहिए, no. But when this nerve comes out, it is very close to the inferior border of L4. So with the prolapse disc over here, that prolapse disc, the nucleus pulposus, very rarely will compress the L4 nerve. Then which is the other nerve? The traversing nerve is L5 nerve. L5 nerve is the one that will be compressed by the prolapse disc between L4 L5. Answer यहाँ पे होना है बेटा L5. Answer over here is L5. Okay, most of the cases it will be L5 nerve. It will compress by the prolapse disc between L4 L5. ठीक है? Answer over here is not B, it is C. B नहीं बेटा, answer C है. Right? चलो, let's see 13th one. After asking a lady to open her mouth wide and say ah, like we examine, the physician notes deviation of the uvula to the left side and asymmetry in the elevation of the soft palate with the right side of palate sagging. As noted, what specific nerve is most likely damaged? आपने मुंह खोला एग्जामिन किया, सिंपल एग्जामिनेशन, टॉर्च एग्जामिनेशन, ओरल कैविटी, इसमें यूवुला लेफ्ट में जा रहा है and there is some disproportion in the height of the soft palate. The right side of palate is sagging down. क्या लगा कौन सी नर्व की प्रॉब्लम हो सकती है? Would it be a left vagus, right vagus, left hypoglossal, right hypoglossal nerve? सोच के बताइए. Already answers are coming. Sarika said 2 times right vagus. अच्छा, Sonke McDonald and अच्छा सब लोग जा रहे हैं right vagus. Yeah, very good. Answer is right vagus. We are dealing with the motor paralysis of the soft palate. Now soft palate, major of all the muscles probably are supplied by the pharyngeal plexus. Basically the vagus nerve is the motor nerve supply of the soft palate. ठीक है? Now right sided the motor nerve supply looks weak. Right half of palate supplied by the right vagus. Answer बन गया हमारा सीधे right vagus nerve. Uvula is being pulled to the left side because यहाँ पर सब कुछ normal है, यहाँ पर problem है. Problem is there in the right vagus nerve. Fine. So let's see the other one. Shown below are the cerebral arteriography findings from a 45-year-old patient. Occlusion of the artery labeled X would most likely result in inability to. Cerebral arteriography आप देख रहे हैं, so you can imagine which vessels are we dealing with. सोचिए what is this arrowed vessel? And if that arrowed vessel is blocked, occlude हो रही है, what will be the symptom signs by the patient? That is the question. Climbing of stairs, grip, whistle, swallow the food. What would be the problem over here? What is this artery? You are seeing this major vessel going laterally. This is the middle cerebral artery. This vessel is the basilar. You can see the branches going behind is the posterior cerebral artery. So what is this labeled artery? Into the medial surface, this is the anterior cerebral artery. इतनी बात clear? Very good. It is anterior cerebral artery. Now the anterior cerebral artery is occluded. Climbing of stairs. What does this anterior cerebral artery normally supply? Let us look over here. This is say the lateral surface of the brain. This is the central sulcus. This is the pre-central, post-central gyrus. The motor area and the sensory area. But we talk about the arterial supply, then the superior frontal gyrus, ये वाला area जो है, it is supplied by the anterior cerebral artery. The rest of all is supplied mainly by the middle cerebral artery. This part of the pre and post central gyrus, the representation of body over here is the lower limb and the perineum. So if the AC is blocked, then this lower limb perineum वाला जो function है, both motor sensory, that will be disturbed. You see the what would be the answer over here? The answer will be option number A. If the AC is involved, climbing of stairs, which include mainly the function of lower limb, will be hampered. Answer ये बनेगा. Gripping, hand, whistling, head, neck, swallow food, these are controlled by these areas. Head and neck area is this, the trunk and upper limb is this. So they will be okay because MC is okay. Problem आएगी in climbing stairs. Right? Let's see 15th one, but again lower limb. A male patient presented with the right leg numbness. Okay? When he walks, he lifts his right foot higher than he does his left. You know what is this known as? Right leg numbness भी हो रही है. He is lifting the right foot higher, and that his right foot slaps to the ground with each step. On neurological exam, he is unable to evert the foot as well, right foot. Which of the nerve has most likely been injured? आपको nerve पहचानी ABCD. These are 4 options. There is high stepping gait. There is loss of eversion of foot. Plus numbness is also there. अब पहचानिए A कौन सी नर्व है, B कौन सी नर्व है, C कौन सी नर्व है, D कौन सी नर्व है. अच्छा A क्या है? Which nerve is A? What is the nerve? Basically we are searching. हम ढूंढ क्या रहे हैं? We are searching the common peroneal nerve. I hope you all will agree because both the SP and superficial and the deep peroneal both are not working. ये because the eversion is not happening, so superficial we can say. High stepping rate because deep peroneal is not working. So in this image, B A is a cone peroneal, as I guess most of you have already answered. नहीं Trendelenburg नहीं बेटा, Trendelenburg is different, that is superior gluteal nerve, वो अलग हो जाता है. Trendelenburg sign particularly, gate बोल सकते हैं. B is the tibial nerve. Then in this image, this is the anterior view, you can see the C is the deep peroneal and the D is the superficial peroneal. Basically, as most of you guys did answer, A is the answer over here. ठीक है ना? A is the answer over here. Right? चलिए, let's see the 16th one. Patient presented with abdominal distension. Patient admits to drinking 10 to 12 beers a day for the last 20 years. On examination, his abdomen is distended with engorged paraumbilical veins. There is also palmar erythema and multiple spider angiomas are present. Before beginning this patient's treatment, which are the following structures labeled on the image below, is expected to have an increased pressure. पहले सोचो हमें ढूंढना क्या है, what we have to search for. Then look at A, B, C, D options. Then you will reach the answer. The whole history, every line of the question is telling us problem किस organ में, liver में. There is obviously portal hypertension. So what we are searching for? ढूंढ क्या रहे हैं? We are searching for the portal vein. Agreed or not? बस ABCD बताइए what is where is the portal vein? Is A is the portal vein, B है, C है, D है, क्या है? Which is the portal vein? वही आंसर हो जाएगा. रुद्राक्ष सिंह B is the portal vein. अच्छा, very good. Anyone else? चलो, we are dealing with the case of portal hypertension and we are searching for portal vein. इतना तो clear है. अब इतना ही बचा है, search for portal vein. Is B the portal vein? Donald saying नहीं जी, C लग रहा है. Donald saying C. बताइए भाई, what do you think? This again you can see the bones over here, white CT. So this is the right side. ये बन गया हमारा left side. This is the vertebrae. So immediately in front of vertebrae to the left, A क्या बन गया? A is the aorta. All of you agree? A aorta है. B is to the right of the vertebrae. B क्या होना चाहिए? Should it be IVC or portal vein? B is IVC. IVC is more. IVC runs on the posterior surface of liver. Going into the porta hepatis, this is the portal vein. C is the answer, that is the portal vein, and D would be any branch coming from the aorta, could be a SMA. Answer ना बेटा, option number C. Agreed? Yes. Someone going with C, few of you going with B. नहीं, B नहीं. Answer बना मैं C. B is the IVC. B IVC है बेटा. Look at the liver. IVC runs on the posterior aspect of the liver, where all the three hepatic veins will go and drain into the IVC. ठीक है ना? Answer हमारा C, portal vein. 17. 27-year-old comes to doctor complaining that the floor of his mouth is painful and swollen. Bimanual palpation later CT shows a 8 mm stone in the right submandibular duct, as shown. बस सब बता दिया इन्होंने पहले ही. There is a sialolithiasis. There is a submandibular duct में stone आ गया है. The most common duct having stones in the salivary is submandibular. 8 mm का stone है, ठीक. If the submandibular duct is partially obstructed, where would the physician observe salivation in the oral cavity after applying pressure to the right submandibular gland? Though there is partial obstruction, so if you massage the submandibular gland, आपको opening कहाँ मिलेगी? Where would you see saliva inside the oral cavity coming out? Because partially obstruction है. Second maxillary molar tooth, oral vestibule, lingual frenulum और sublingual fold. बताइए. Question बस इतना है. Where does submandibular duct open? ये एक लाइन का क्वेश्चन है. They have shown you this and the image over here. सबलिंगुअल फोल्ड. कुछ आंसर आ रहे हैं. सी आ रहा है, ए आ रहा है, अरे ए बी, ए सी डी सब आ रहा है. ओके, देखो बेटा, मैक्सिलरी मोलर टूथ, मैक्सिलरी इज द अपर जॉ, सबमैंडिबुलर ग्लैंड बेटा यहां पर है. ऊपर क्यों जाएगा? तो ए तो छोड़ दो, है ना. देयर इज ओपनिंग ऑफ पैरोटिड डक्ट. ओरल वेस्टिबुल इज बिटवीन द चीक एंड द गम्स, उसके बीच में जो स्पेस होती है, दैट इज वेस्टिबुल. ठीक है, देखते हैं. फ्रेनुलम, इफ यू लुक एट द अंडर सर्फेस ऑफ द टंग, यू सी ए मिड लाइन फ्रेनुलम. वहां पर कह रहा, वहां पे ओपनिंग होगी. और बिलो द टंग, if you look at if you feel the floor of the mouth, there is a small fold. वहां पर बेटा sublingual gland रखे हैं, that is known as sublingual fold. Where does submandibular, they are not asking sublingual, they are asking submandibular duct. कहां पे open होगी? Answer is it opens on the side of the lingual frenulum. जो फ्रेंडुलम ऑफ टंग होता है उसके साइड में दे ओपन. Answer is option number C. Good job, Sarika and Donald. I suppose if you went with option number C. Let me show you an image actually. What we are dealing with this. This is the tongue has been pulled up. The tip of tongue is touching the hard palate. Upar. So you are seeing the ventral surface of tongue. The under surface, all the ventral surface. This is the midline frenulum. अब देखो. The floor of mouth. This is the area for sublingual gland. Sublingual salivary gland. और duct जो है submandibular duct है. That is actually traveling through it and opening right around the on the sides of the lingual frenulum. Where does sublingual duct? But a sublingual gland has a lot of minute ducts. They open on the entire sublingual papilla. The पूरा sublingual papilla है, sublingual fold है. Various openings of the sublingual small ducts. But submandibular duct opens on the side of the frenulum. So number answer over here will be the lingual frenulum on the sides of frenulum. ठीक है? चलो. Let's see another one. बताइए. At what spinal level does this structure pass through the diaphragm? Thoracoabdominal diaphragm. Identify this structure. And then if you can identify it, then you should know the theory, the three major openings. Help yourself. बताइए. Waiting for the answers. Okay, B आया है पहला आंसर, I guess. So what is this structure? Diaphragm में बता दिया already. What is the structure? ये क्या है? Is it the IVC? Is it the esophagus? Is it the aorta? What is this? This is the inside the central tendon of diaphragm into the right border of the heart. This is the IVC opening over here. Aorta opening is over here and यहाँ पर कहीं बीच में esophagus होगा, just behind the heart. And we know theoretically IVC opening is at T8. Though there is a lot of variation. अगर हम reality की बात करें, if you look at the other images, then IVC, aorta, esophageal opening में they don't have much difference. But the vertebral difference होता है, vertebral level difference is not much. But theoretically we go T8 is IVC, T10 is esophagus, T12 is aorta. So we have to identify the structure था IVC and the vertebral level was T8. जी हाँ, बिल्कुल सही. T8. Right? आगे चलते हैं to the 19th one. बताइए. The CT scan shows a left crescent shaped extraxillary hematoma. Crescent moon shape. Compressing the brain of a 17-year-old woman who impacted the front of her head on the steering wheel during a head-on motor vehicle accident. Given the radiological imaging results and the history, what blood vessel is most likely source of this cerebral hemorrhage? Crescent shaped extra-axial hematoma है, सामने head-on injury हुई है. बताइए, which vessel is most likely the source of this particular hemorrhage? Middle meningeal artery, superficial temporal, what it is? A's and D's आ रहे हैं भाई. अच्छा, is it a epidural or is it a subdural or is it a subarachnoid or intracerebral hemorrhage? क्या है ये? What is this? इतना आंसर दे दोगे बस, बाकी story is simple. But you just try to identify what is this? Epidural, subdural, subarachnoid, intracerebral. क्या है? What is this? इतना आंसर चाहिए बस. Not saying subdural hemorrhage. अच्छा. Sorry, yes, it is a subdural. It is a subdural. बस आंसर हो गया. Crescent shaped, subdural, concussion, counter concussion, rupture of bridging cortical veins, veins, मिल गया आंसर. Superior cerebral veins, rupture of superior cerebral veins. Those of you going with MMA, it is basically the EDH के लिए होता है. And there is not this concave convex, it is a biconvex, small shadow. Plus, there will be a direct injury on the lateral aspect of the skull, particularly around the pterion. वहाँ मिलेगा. Let's see 20th one. 16-year-old boy making a powerful move out of the starting blocks to begin a 100-meter sprint. Feels intense pain below his right knee and collapses to the ground, unable to straighten his leg. The given plain film, unable to straighten the leg. The given plain film of the lateral knee reveals an avulsion fracture of the area indicated by the white arrowhead. यहाँ पर हुआ avulsion fracture, arrowhead. With the fracture segment by the white arrow. यहाँ से segment उठ के यहाँ आ गया. Segment moved from here to here. Which muscle is most likely detached? अब बताइए आंसर. Gastrocnemius, tibialis anterior, adductor magnus or rectus femoris. Look at the whole history of the patient. Answer मिल जाना चाहिए. Intense pain below the knee, unable to straighten the leg. आपको सब दिख रहा है कहाँ पर है. This is the patella, femur, tibia, fibula. Patellar ligament, quadriceps femoris. Main action is extension of the knee or straightening of the leg. वही नहीं है. Watch which is the single muscle over here of quadriceps femoris. Answer बन गया rectus femoris. Simple as that. Gastrocnemius is present on the posterior leg. Tibialis anterior नीचे आगे. It is going into the leg and into the foot. Adductor magnus middle में. बचा ही. There's only one option. Rectus femoris. One of the quadriceps femoris muscle. I hope it is clear. आगे बढ़ते हैं 21st पे. Let me do around 25 questions तो करेंगे. कुछ और पे. Again lower limb. Physician performs some simple muscle test on 35-year-old male patient and when he complains of weakness. In the physical test, the patient is asked to touch his buttocks with his heel. So बोला गया कि अपनी heel लीजिए अपने buttocks पे touch कीजिए against while working against resistance. So doctor is giving resistance from here. करो. What muscle group is being tested? बता दीजिए भाई. सारे going with option number B. Hamstrings. अच्छा. So what is the main action being asked here to do for the patient is to flex the knee against resistance. Resistance आ रहा है flex करो knee में. Flexion of knee against resistance basically done by the posterior leg, posterior thigh muscles. हाँ जी, very good Elsa and Sarika. Posterior thigh muscles are known as the hamstrings, the semitendinosus, the semimembranosus. Other options देख लो, quadriceps femoris, उल्टा opposite है. Adductors, triceps suri, मतलब नहीं triceps suri again in the posterior leg. I hope it is clear. Again low limb, very frequently asked nowadays. Young man suffers a dislocation of the right hip in a car accident. Right hip का accident हो गया. During recovery, he finds he has an abnormal gait in which his left hip sinks when he lifts that foot to take a step. जब ये left foot उठाता है चलने के लिए, when he lifts the left foot off the ground to take a step, the left hip sinks down. That is what they are saying. Problem may be the result of damage to which of the following structure. भाई right hip में accident हो गया तो left hip नीचे जा रही है. Trendelenburg sign. Problem कहाँ है? A B C D. D's. D क्या है भाई? Right superior gluteal nerve. Sure. Absolutely. It is the right superior gluteal nerve because the history is saying the right hip में accident हुआ था. Right superior gluteal nerve supplies this right gluteus medius and minimus muscle. Normally what they do is when you take the left foot off the ground, ये normal अगर हम इसको यहाँ पर लें, when you take the left foot off the ground, these on the right side, the right gluteus medius minimus muscle, which are supplied by the right superior gluteal nerve, they contract and they keep this the level of the hip at the same level, right? Both side of the hip at the same level. Once they contract, they will pull in this direction. But if these muscles are not working due to the damage to this nerve, then obviously they will not work, and obviously this left hip will sink down once you take the left foot off the ground. Problem आई right superior gluteal nerve. ये आज बहुत पूछा जा रहा है, so just be sure about it. Let's see 23rd one. बताइए एक upper limb में से. As a part of examination to evaluate muscle function, physician is holding the PIP joint of the patient index finger in the extended position. This is PIP, a dot. And this is the DIP. ये D लिखता हूँ यहाँ पर मैं I am writing P. PIP DIP. Physician is holding the PIP joint in the extended position and instruct to the patient to flex the DIP joint. उसे बोलेगा कि इसको flex कीजिए. Which muscle is the doctor testing? बताइए what is the answer over here? A B C D. FDP, extensor indicis, first lumbrical or flexor digital superficials, FDS. The doctor is asking the patient to flex the DIP. ये क्वेश्चन है बस. Sarika, Donald and going with A option. Simple. This if I hold my PIP joint like this and I ask myself to flex the DIP, इस तरह से. Simple. The only tendon that is reaching the distal phalanx is the tendon of FDP. Answer क्या बना? Answer is our FDP, flexor digitorum profundus. And if they ask you which nerve is supplying this FDP for the index finger, the index finger is FDP है. That has been supplied with which nerve? It is the anterior interosseous nerve, branch of median nerve. Fine. 23rd. FDS reaches up till middle phalanx. So the only muscle, only tendon crossing the DIP anteriorly on the palmar aspect is the FDP tendon only. बात खत्म. 24. आइडेंटिफाई द मार्क्ड फोरामेन, दिस इज द फोरामेन, ये एक मार्किंग यहाँ ले लो, एक मार्किंग ये ले लो. आइडेंटिफाई द मार्क्ड फोरामेन, दिस बटरफ्लाई शेप्ड बोन. बताइए भाई कौन सा फोरामेन है ये? रोटेंडम, ओवल, विडियंस और द स्पाइनोसम. अप टू यू. Bone is this sphenoid bone. Bone is the butterfly shaped sphenoid bone. This we are looking at anterior view. Why? Because these are the air sinuses. They open anteriorly. This is the orbital surface. These are the pterygoid processes, pterygoid plates. This area is the pterygopalatine fossa area. And this foramen which you are asking is the rotundum. उसके middle में this is the Vidian canal or the pterygoid canal. Answer over here is foramen rotundum. And I will be glad to hear from you guys what passes through rotundum. ये आप बता दो. Yes, it is rotundum. What passes through rotundum? ये भी बता दो बस last चीज. What structure passes through foramen rotundum? इससे क्या निकल के बाहर आएगा? What will come out through this? Answer is the maxillary nerve. If you are thinking maxillary, very good, correct. चलिए 25 देखते हैं. Now this is the image over of the sphenoid. The labeled image. You can see this is what they ask you. Rotundum. तो बीच में other labeled over here. This is the anterior view. And this would be the superior view. This is what is forming the middle cranial fossa. अगर skull cap हटाओ, then you see this. This is rotundum over here going anteriorly. यहाँ से होगा. This is ये वाला जा रहा है. Oval and spinosum, Ross. This over here between the lesser and greater wing is the superior orbital fissure. ये optic canal हो गया. And this you can see over here. चलिए, 25th question also let us see. We'll do a few more. Identify the type of cartilage, fibro, hyaline, elastic, articular. बताइए भाई. You are seeing some big cells. You are seeing some fibers also in between. You are seeing it. ऐसा नहीं है दिख नहीं रहा है. You are seeing it. Is it clean like a glass? नहीं, लग तो नहीं रहा. There some fibers running. Is it clean like a glass? नहीं, hyaline तो नहीं होगा. Articular is hyaline cartilage. Fibroelastic which are looks like elastic fibers. हो गया ना? What about fibrocartilage? Fibrocartilage, there you see a row of chondrocytes. In the beach, when there's thick collagen fibers. Then again you see a row of chondrocytes. In hyaline, you don't see any fibers. Though they are there. ऐसा नहीं है नहीं, they are there. But you don't see it because the refractive index crashes and they nullify. ठीक है ना? हाँ जी, see elastic, very good. चलिए, let us see another. बताओ भाई. A female is evaluated for infertility. Histogram is obtained as a part of comprehensive evaluation. Which embryological process failed in this patient? ये कुछ histogram है. समझो क्या है ये? Is it a which process failed? Failure of fusion of paramesonephric duct, failure of fusion of mesonephric duct, failure of differentiation of mesonephric tubules, or failure of involution of paramesonephric duct? क्या? Up to you. सोचो. In this uterus. Septate, है ना? The paramesonephric ducts are the ones which fuse to form the single uterus. Side में they have the two fallopian tubes and they fuse from craniocaudal and they form this single uterus and cervix. Fusion का fail हो गया, so there is failure of fusion of paramesonephric ducts. Paramesonephric also known as the Mullerian ducts. दूसरा नाम है the Mullerian duct. Right? Answer is option number A. Option number A is the answer. 27 पे चलते हैं. बताओ भैया क्या है? This I asked in my Telegram groups also. ये एक दो क्वेश्चन आप पूछे थे पहले. A boy born to a 31-year-old homeless lady is presented with this clinical finding. Pregnancy was complicated by preeclampsia and UTI. ठीक है ना? Which was treated by cephalosporin, the cephalosporin. The abnormality described in this patient could have been prevented with. इससे बचा जा सकता था. Could have been prevented. Now prevention is always better than cure. बताओ भी. Alcohol cessation, vitamin supplementation, avoiding antibiotics or hypertension control. B. B क्या भाई? Which vitamin? कौन सी vitamin बात हो रही है यहाँ पे? What is this case over here? You're correct guys, it is spina bifida occulta. The tuft of hair. ठीक है? And neural tube defect. Neural tube defect, spina bifida occulta, tuft of hair. Which vitamin supplementation? This is a folic acid. And what is the dose which is given for the pregnant female? Few weeks before they plan pregnancy and obviously in the few trimesters, first and second trimester. हाँ जी. What is the dose? Folic acid है B9 है, very good. What is the dose? Dose क्या है? Folic acid की जो देते हैं, which is actually prescribed. Dose is 4 gram नहीं बेटा, 400 microgram. ना 400 microgram is around 0.4 I suppose ना. 400 microgram है वो. ठीक है, ग्राम नहीं, ग्राम तो will be many milligram and all that. It is 400 microgram. ग्राम तो बहुत ज़्यादा हो जाएगा, right? So around 400 microgram is the dose. You can check it in your option gynae as well. What is the latest recommendation? But what we used to study was 400 micrograms per day. है ना? हाँ, 0.4 mg. 0.4 mg is the not. It is 0.4 mg. 0.0004 gram. चलो, whatever it is, by vitamin B9, folic acid, nutritive defect. बताइए, what is this being asked over here? A patient is being evaluated for recurrent UTI. Her abdominal CT is shown below. Which of the following is most likely prevented? Which of the following most likely prevented the proper ascent of the anomalous organ? कुछ organ है इसमें which is anomalous, जो they showing some anomaly, उसका ascent, which is preventing the ascent of the anomalous organ. I hope you got the point. पूछ क्या रहे हैं लोग? And you can see also in the image में भी दिख रहा है. बताइए. Indian Medical Association, D, IMA, inferior mesenteric arteries. Anomalous organ we are seeing is the horseshoe-shaped kidney. Kidney problem आई है. There is a horseshoe-shaped kidney, and its ascent is prevented by this IMA. IMA, can you tell me which vertebral level normally comes out from the aorta? किस vertebral level पे आती है IMA? From the aorta. So you will have a rough idea. Kidney, where would the kidney lie actually? Around, roughly idea. So if you know the approximate vertebral level where the IMA is given off from the abdominal aorta, the vertebral level is, ना बेटा ये नहीं आंसर तो D है, sorry हाँ D है, L3, very good, answer is L3, around L3. So the kidneys you can imagine would be lying where, so this is very important. IMA. चलिए 29th question also, एक और brachial plexus. Welcome again to the brachial plexus. 43-year-old lady comes to a physician because of tingling and weakness in her left arm. ध्यान से देखो क्वेश्चन को, important है. Tingling and weakness, tingling भी sensory motor दोनों, in her left arm for past 2 days. Image of the brachial plexus is shown. NCT nerve conduction studies were shown to decrease the transmission of electrical impulses in the labeled structure. Labeled है बेटा ये, can you see a circle over here? That is the labeled structure. Physical examination is most likely to show impairment of which of the following movements. ध्यान से देखो क्वेश्चन को and try to think. सिमू बेटा L1 नहीं L3 होता है. L1 is for SMA. चलो आते हैं इस brachial plexus पे. कुछ लेफ्ट आर्म में प्रॉब्लम आ रही है. This is the problem. NCT में यहाँ प्रॉब्लम आ रही है. क्या मिलेगा ऑप्शंस में? Will there be impairment of extension of wrist and fingers, impairment of position of thumb, impairment of flexion of the MCP joint, impairment of flexion of forearm? क्या मिलेगा? सोच के देखो. A. अच्छा, extension wrist and finger. Why? Which nerve is this probably? Let's come back. This is the root. ये 3 trunk हैं. These are divisions. These are the cords. Cord की निकली branches. Cord में this is the posterior cord. The main 2 terminal branches of posterior cord are radial nerve and axillary nerve. ये 2 होती हैं. Radial and axillary. This you should know. है ना? Radial and axillary nerve are the 2 basic terminal branches of the posterior cord. अब अगर axillary nerve damage है, this the, now see both are shown as a similar fits, so we can't judge. Though radial nerve is the quite thick compared to axillary nerve, because radial nerve supplies quite a number of muscles and the skin area and all that. But if the axillary nerve, if they are referring to axillary nerve, then what will happen is that there will be weakness of deltoid and teres minor. The radial nerve is involved, there is a whole weakness of the posterior compartment of the whole upper limb. Now if you look at the options, पहला option ही extension of wrist and fingers है, represented by the radial nerve and its branches. हाँ जी, तो this probably the answer तो यही है. But let us look at other options. कोई axillary nerve we shouldn't confuse. Option number B is apposition of thumb. Apposition of thumb, opponent's pollicis. Which is the nerve? Median nerve. Flexion of MCP joint. Flexion of MCP joint again basically the median nerve. Right, flexors. Flexion of forearm, musculocutaneous. बचा आंसर ऑप्शन है. That is answer. We are referring to radial nerve over here. So पहचानिए इसे समझने से. Let me label more nerves for you. ध्यान से देखो. If you say these are the chords, this is posterior, तो ये lateral, this is a medial chord. This is the lateral root of median, medial root of median, ये median nerve है. This we have seen radial है, this is the axillary nerve. The continuation of lateral cord is musculocutaneous, and this medial cord continuation is ulnar nerve. These are the 5 terminal branches of the whole brachial plexus. Musculocutaneous, axillary, A से axillary, M से median, R से radial, U से ulnar nerve. Should I be able to identify it? ठीक है? चलो एक और देखते हैं. Lower limb question. Rugby player injures his left extended knee when hit from the lateral side by a defender trying to tackle him. He was hit from the lateral side, मतलब बाहर से ही बस hit. Okay. While performing a knee examination, physician applies pressure to his lateral thigh, ये lateral thigh है, and medial leg. This test is to check the integrity of which of the following ligament. क्या ligament check कर रहे हैं? चोट यहाँ से लगी है. You can see where the physician is putting the hands. हाँ जी. Are they checking the tibial collateral, fibular collateral, anterior or the posterior cruciate? Easy question है, common sense question है. चोट बाहर से लगी है on the lateral side, and you can see how the physician is testing. So यहाँ क्या test कर रहा है? Ligaments. Which ligament? 4 options are all the ligaments. A, Shreya going with A, Sarah going with A. Yeah, very good. They are checking this ligament, the tibial or the medial collateral ligament. Because injury is happening from the outside, this would have been stretched. Cruciate के लिए we do the draw test and other tests for cruciate. The lateral ligament would probably be okay, hopefully injury, but the test is different. By doing this, the doctor is actually stretching the medial collateral ligament and looking for an instability in this area compared to the other leg as well. Okay, answer is option number A. So let us do one more. 31 कर लेते हैं. Here it is. 50-year-old is brought to the emergency 30 minutes after being involved in a motor vehicle collision. He has a mild abdominal pain, but a CT shows no abnormalities. कोई abnormality नहीं है, no abnormality. The patient is discharged after a day. The structure identified by the arrow in the image is shown most likely has which of the following embryonic origins. ये जो structure दिखा रहे हैं यहाँ पे arrow से, this is the arrow over here. एक और arrow बना देता हूँ ये रहा. It has a structure from which of the following embryonic origins. सोच के बताओ. Ductus arteriosus, mesonephric duct, vitelline duct, or the umbilical vein. What is the structure over here? ये structure क्या है? ये बताइए. It is a CT, वो normal है. It is normal. They are saying CT has no abnormalities. So CT तो normal है. But ये क्या है? What is this area? वहाँ पे आपका आंसर होगा. सोचो. Think. CT है. This is the right side. That's the left side. Anterior, posterior. There's the liver. Liver के अंदर what is this? This is the area for falciform ligament. What is there inside the falciform ligament is the ligamentum teres, है ना? And ligamentum teres is coming from embryonic origin. क्या है ligamentum teres का? Has the left umbilical vein. ठीक आंसर बना left umbilical vein. देखो how they are combining the radio, anatomy, embryology सब जोड़ दिया. Ductus arteriosus will be there in the heart, तो ये तो भूल ही जाओ. Mesonephric duct giving rise to the urogenital structures, urinary structures, and in males. Vitelline duct, again vitelline duct बात खत्म हो गई. That is probably from the umbilicus and all. बचा हमारे पास umbilical vein, ligamentum teres hepatis, and which umbilical vein? Left umbilical vein, left side की umbilical vein होती है. Clear? चलो guys, so these were our IMAGETHON image-based questions. There are many other questions as well. So hope to see you guys in other sessions. All the best. कोई doubt है, ask me in the comment box, or you can reach out to me in the platforms. More than happy to help you out. Thank you and all the best. Thank you for your time. Bye-bye.